Hey everybody, my name is Darian Dozier and welcome to Melanated and Meducated. Alright, hi everyone, welcome back to Melanated and Meducated. My name is Darian Dozier and today I've got Dr. Jade Norris with us today. How are you doing, Dr. Norris?
I am doing well. Thank you so much for having me, Darian.
Thank you for joining us. We're so excited to continue this monthly interview series. And so I'm really grateful that you were able to take the time out of your schedule to come sit down with me.
It is a pleasure.
Well, I'm just going to go ahead and dive right in. And I'm curious to know, where are you from? Can you give us a little bit more information about your background?
Yes, I'm Dr. Jade Norris. I'm from Las Vegas. That's where I was raised, born in Chicago, but raised in Las Vegas. And I am currently in my last month of family medicine residency at Loma Linda University in California. And I'll be opening my own private practice, medical practice called Inspire Primary Care in February back in my hometown in Las Vegas. So I'm very excited to bring it all full circle and head back to my hometown.
That's super duper exciting. And I bet you're glad to, finally be done with residency, get a real paycheck.
Absolutely. I mean, I'm venturing out on my own, but I couldn't be more grateful. It's been a long but rewarding journey, and I'm sure we'll get into that some more.
Does that make you nervous to start your own practice, or what are the steps you've taken to make that happen?
Yeah, so it's very new because we opened in February. Basically, I always knew I would like to open my own practice. However, I wasn't sure how that would work as many private practices were closing down when big hospital chains opened. And I learned about this would be like a totally another interview. However, I learned about a type of practice style in primary care called direct primary care. It's a membership model and you don't bill insurance at all. So it really takes all of the hassle out of it and just makes medicine basically old school medicine with a modern twist, and allows me to have my patients have my cell phone number and to be able to contact me directly and see me same day, next day, 30 to 60-minute appointments. I'm so excited. So I feel like I'm going to be giving the quality care I always hoped to give my patients. And the only way I could really practice medicine the way I always dreamed of was to do it this way on my own.
That's awesome. And I actually have a professor who I'm pretty sure she uses that exact same model and she absolutely loves it.
That's awesome. I'm so glad more med students are starting to hear about this model because it's a fantastic alternative.
Yeah, and I go to a school that emphasizes primary care. So if students knew of more options where you don't just have to work in a clinic or a hospital, here are these other options that you can use, I think that'd
Yes,
be really helpful for them to know.
absolutely. And I'm always happy to talk about it. I look forward to treating my patients the way I always dreamed of it. It's so exciting. Of course, it's nervous. I'm scared, all of that. However, I'm mostly excited.
Good, that's good. Okay, so the next thing I'd like to know, taking it all the way back, what inspired you to go to medical school and become a doctor?
Yes. Okay. So I have one of those cliche stories of always wanting to be a doctor from the age of, a little girl. But my earliest remembrance is 4 years old, career day. You had to say what you wanted to be when you grew up. And I dressed up, you have to dress up like what you wanted to be too. So I came in like a big white t-shirt, that was my white coat. And I said I wanted to be a doctor. And that was the earliest memory I have of really wanting saying it and verbalizing that I wanted to be a doctor. But I remembered going to like my pediatrician appointments and just being so fascinated, asking my pediatrician a million questions, loving watching them give me shots. I was like a weird kid that was just loving everything about it. And so I've always had that interest. And the goal just never changed as I, went through elementary, middle school, high school. I continued to really be interested in medicine.
Okay, that's awesome. I love the stories. It's like people knew when they were a little kid because I did not. I had no idea when I was a little kid. I wanted to. Well, my parents will tell you I wanted to work the breakfast drive-through at McDonald's.
Okay.
It was very specific, but that was my dream job. I don't remember that, but I I wasn't there for that. But yeah, no, I had no idea until high school. So I love to hear when people started out as little tots who wanted to be doctors. So the next thing I'd like to know is, can you tell me a little bit more about your journey to medical school? Any bumps, trials, tribulations, any tips for anyone who's thinking about applying to medical school?
Oh, that is a loaded question because yes, I've had lots of trials and tribulations. I share my story quite a bit, especially on my Instagram and my social media. I really share the ups and the downs of my journey. I think it's a beautiful part of my testimony. I can reflect back now and think it's a beautiful part of my testimony. But yeah, high school was very easy for me. I was a straight A student, kind of top of my class. I really didn't start having challenges until undergrad, because at that point, that's when I realized that my school district wasn't what you would consider a competitive school district. So although I was thriving in that school district, once I was in undergrad with some of the top thinkers, in the world, it was much more challenging. And I also realized at that point that my test taking skills were not up to par where you needed it. Once it was just like no homework, no extra credit, no assignments. It was just 3 tests and you average it and that's your grade. Once that was the system I was in, it was a steep learning curve for me to really master and hone in on my standardized test taking skills. And so that was where my challenges started, was undergrad. I got really, decent grades, had a standard GPA to apply to medical school. So it wasn't too challenging until the MCAT. And I did take that a couple of times, I think twice. But the second time I went to a prep program called Med Prep to assist me in my test taking skills for the MCAT. And so that was my biggest challenge initially, is just getting into medical school, right? And so I tell the story of, sending out 20 applications and getting one yes, 19 no's and one yes. And so I would go to the mailbox and open envelope after envelope of no, no, no. And it was very discouraging. It was a hard time, but all you need is one yes. And so, and then, God really blessed me with a full ride scholarship to that one yes. So it was more confirmation that I was right where I was supposed to be, and my journey was working out, although not without any hurdles and difficulties. It was working out according to his plan. So went to medical school, had challenges in medical school, again, mostly around test taking. And it was just a skill I had to continue to work on and strive for, and take prep courses for step 1 and 2 and 3 and all the things just to get through. But you get tutoring, you go to the prep courses, you do what you have to do to strengthen those areas of difficulty that you're challenged in. And so it's rewarding now, because now I can help other students, especially that struggle in those areas. And so I would just say, advice-wise, to stick with it, to work on your quote unquote weak areas, that you don't have to take a traditional route, that your journey doesn't have to look like everyone else's journey just because it's easy for everyone else, or the majority of people that discuss their scores or their tests or things like that. You can still get through. I think that's the biggest misconception, is most of the time, if you're not a traditional student taking a traditional route and passing the test just like everybody else, then you can come along with these advisors that say, maybe this isn't for you. And I had heard that many times, and that is not the case, So really attract yourself to people that can encourage you and help you along that journey.
Yeah, and I definitely agree. I've heard many times, people were struggling with their grades or with their exams, and they were encouraged by advisors whose job it is to advise you to choose something else and to do something else. And
Absolutely.
for me, I'm like, where is the help? Like, I'm not asking you to help me choose a different career path. I'm asking you to help me get where I'm trying to go. And so when you forget that that's your job, then you find yourself discouraging other people who maybe need a comeback story. They're the underdogs, they're trying to come back, but they need that assistance and that help.
Absolutely. And that's why I'm so big on mentorship, because if I can be that person for someone who I needed along my journey, then that's why God got me through.
Exactly. And that's the whole reason that I started my blog and why I like doing these interviews because I know I struggle trying to figure out how to apply to medical school, and I would have wanted a resource like this. And then I also know that there are not a lot of Black doctors on TVs and on social media. That's where I find everybody. But in the larger scheme of representation of physicians, doctors of color are not there. So I love having this interview series to showcase, here are these doctors that look like you. Here was their struggle. Maybe you went through something similar. Here's how they got through it. So here's something that you can try.
Absolutely. It's wonderful what you're doing.
I'm trying. Now I just need the views.
They'll come. They'll come.
It's a slow work in progress, but I'm determined to keep at it because I love these interviews. I get to learn so much about different physicians, and I love it. So now I wanted to know, what was your experience like in medical school? You've mentioned test taking and how that was a bit of a struggle for you, but what else were some things that you went through during medical school that you feel like either helped you or hindered you? And some wins that you had and some L's that you took.
Yes. So, growing up in Las Vegas, it was a very diverse upbringing with lots of ethnic backgrounds and cultures, and that was my norm. And so when I got into medical school, I moved to a more rural Midwest city. And that was a whole new world for me. It was a bit of a culture shock. And long story short is that I did experience, racism. I experienced lots of isolation, just cultural isolation, and I wasn't used to that. And so a huge lesson I learned was just on grit, endurance, pushing through even when you feel alone, knowing that you're not alone. And church was huge for me, finding a church family that really wrapped their arms around me and supported me, although I did not have that type of support built in the medical school itself. So those were the things I had to push through, was just the cultural shift in medical school. And wins, I mean, I had so many wins. I just feel like God put so many angels in my life along my journey, and would send me mentors that really did take me under their wing, especially mentors of color that really took me under their wing and would tutor me on the low and, would quiz me and help me prepare and connect me and take me to medical conferences with them and really encourage and empower me. So those were definitely wins.
So would you say that it very much helped you to have that support of faculty and mentors and classmates that looked like you?
100%. 100%. When you are in an environment where, one, I didn't grow up in a family. I'm the first physician in my family. So I don't have that built in where it's like, oh, just do this or just study this, or here's my old book, or here's my old colleague. You just follow this formula and it'll work out. If you don't already have that built in, to not have it built in the ecosystem of your institution is definitely a setback. So yes, having the faculty that were able to, specifically in our diversity office, that were able to really take us under our wing, people that looked like me, men of color, women of color, was huge and crucial. And typically there was just one or two. So
Right.
it was a big deal.
And that's something that I just, I could die on the hill about this, about that importance of representation in medical schools, because first of all, I started medical school in a pandemic. So we already were all isolated from one another. And then there was only one other Black female in my class, and she was in a different learning community, which are like our little cohorts, than me. So we didn't even meet until October. And so, experiencing some of these things, feeling like everyone has all these resources that are already vetted and they already know where to go. I'm like, I don't have any of that. And so, just like you said, having that network, like the Black students who are in the class below me, they come and ask me questions. I'm like, I use this, this, and this. And it's like, I would very much like to have had that support, which is just another reason you got to diversify medical schools.
Yes, absolutely. Diversity and representation definitely matter. And it's important and it makes a huge difference.
Exactly.